Good morning, and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well today and staying warm. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Trying to warm up.
Exactly.
Chicago today.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering a viewer-submitted question, addressing the latest headlines, and our lone U.S. COVID statistics through today, December 12th. We invite you to submit your questions below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting out with those COVID numbers, in the last reported week, average COVID deaths per day were 42, and in the same week in 2023, we saw 203 daily COVID deaths. Dr. Murphy, your reaction to those numbers?
Well, this is great. This is coming down off the summer wave. We're pretty much near the bottom, and I think the important thing is to compare it to what's happened in previous years. So this is markedly lower in 2023, and every time we report this, it's always been lower than 2023. So we hope that this just will increase over time as more people get COVID and get immunity from that, and more people keep up with their vaccines, which will give even more immunity in the entire population. So this is great. And if you look at the wastewater data everywhere in the United States anyway, is low. Now, it's going to change because it is really expected to come up with the flu. It's already started, but just in very small amounts, but that should pick up in January, February. We'll see what.
Yes, while all US regions in that wastewater data are in the low to minimal range right now, we are seeing some upticks, especially here in the Midwest. So still very low, but things are starting to ramp up. But before we move on from COVID, there were two really big studies published very recently describing COVID vaccine efficacy against long COVID. Can you break that down for us?
Yeah, there's two large studies, one in US children and the other in adults in Japan, that showed that the COVID-19 vaccines are protective against long COVID. Now, we've been talking about long COVID for a long time. And we used to think, about 7% of people will still have symptoms after 3 months, but some more recent data show that maybe it's as high as 20 or 25%. So long COVID, if you have it, it's real and it's debilitating. So anyhow, the first study, which was published from a subjournal of The Lancet, was conducted in 20 United States health systems as part of a Recover Hook Hornet electronic health record program. There's a lot of people in this program. 112,000 adults approximately who were vaccinated during the Delta wave, and almost 190,000 adolescents in the Omicron wave. During the Delta period, which was early on in the pandemic, as you remember, the vaccine, in this case, we're looking at the Pfizer COVID vaccine, but it doesn't matter which one. The vaccine efficacy against long COVID was 95%. I mean, really, really good. However, when Omicron came along, there was a lot more immunity, so the vaccine had less protective effect. And in these children, the estimated effectiveness against long COVID was 60% in kids and 75% in adolescents, so down from this 95%. So the risk reduction in developing long COVID was largely linked to reducing the risk of COVID overall. So it's actually two things: less COVID, but less long COVID. So it's probably because of milder disease. So then the other study is in adults in Japan. A little bit confusing. That's medicine, though, and research. In Japan included almost 8,000 participants between ages 20 and 69. 11.8% had at least one post-COVID or long COVID symptom, according to a questionnaire that was given to all these people. And they found that the vaccine effectiveness, if you took 3 or more doses of the COVID vaccine against Omicron-related long COVID, the efficacy was 30%. And for neurologic symptoms specifically, it was 39%. Okay, it's less than what we've seen before, but it's still effective. The twist here was that they found that the effectiveness was only significant in women, not in men. Now remember, women also are more prone to have long COVID. So, you know, how this all ties in, we don't really know. But they definitely showed that there's fewer respiratory symptoms, but specifically fewer neurologic symptoms compared to unvaccinated people. So a little bit confusing, but also, you know, that's the data are the data.
Yeah, and that's exactly why we are so fond of peer-reviewed journals where you can put out your data and experts from all over the world can, help contextualize that or follow up with further
Yeah,
research.
I mean, and what's the situation in Japan? Can we really translate that to the US population? You know, I mean, this is, of course, of interest, but this is, it's still showing that, you know, you can prevent long COVID if you get vaccinated.
Mhm. And speaking of those COVID vaccines, we had a submitted question this week from a longtime viewer who was wondering if the Novavax vaccine is effective against COVID-19 the same way the mRNAs are, and if that Novavax vaccine is more well tolerated, fewer symptoms after the shot.
Yeah, so the Novavax vaccine is designed and manufactured and built like the vaccines before COVID. It's kind of the regular way, the protein based of, you know, that they have making vaccines. So it's kind of the quote old fashioned way, and the mRNA is this novel newer way. It's takes a little bit longer to make those vaccines compared to the mRNA vaccines. At the end of the day, you're presenting people with, you know, an antigen that you make the antibody to, and you've got some protection. But anyway, turns out they work the same. There's no big difference in efficacy. The difference is in side effects. There's much less side effects with the Novavax vaccine. So you have a lot of side effects when you take the mRNA vaccine, and look around for a Novavax vaccine and get that one the next time. It's going to work the same, and you may tolerate it a lot better.
Yes. And that is not an absolute guarantee that you will have no side effects from a Novavax vaccine,
You
but
can still have side effects, but it's less.
Very good to know. And we need to delve right into this story from last week that has been very huge all over the world. And this is Disease X, the mystery illness in Congo, the Democratic Republic of the Congo, that is. Can you please fill us in on everything else that's happened since last week?
Yeah, so there's this region in southern Congo, about 400 miles from Kinshasa, the capital, that started reporting this mysterious illness that's killing people, especially children. The numbers have been all over the place. You know, the definition of the disease, the number of deaths, all that has been kind of a little bit hazy and gray. It's real, but you know, how real and how many, we don't know. But the Africa CDC and WHO have been down there trying to figure out what is going on and what is causing this. So when we first reported this, I think it was 2 weeks ago, they had originally reported over 140 deaths. And the mortality rate compared to the number of people who've been sick, which is a little bit over 400, it was 37%. That's all changed. They still have the overall number at 416, but the number of deaths have ranged now, and depending on who's counting, between 31 and 39. So it's not quite as, it's still bad, but it's not quite as devastating as we had originally thought. They still don't know what is going on. They don't know exactly why, but if you look at the cases, most of them are in children. And most of the children have severe malnourishment. So that's a huge risk factor for dying from any kind of disease, including malaria or COVID or anything. So we're not sure exactly if it's something new or this is just malnourishment in a place where, you know, there's other things causing respiratory illnesses like influenza and also malaria. So they looked at the malaria cases there. Malaria is the leading cause of death in the DRC, the Democratic Republic of the Congo, and they found that most of the kids they're looking at and the specimens they're looking at, they have malaria. So like almost everybody has malaria, and it's the rainy season now, and so you know this is just the way it goes down there. So the impact of malaria, we don't know exactly the impact here, and or if they're really dying of malaria, and then the malnourishment, or it's some new disease. It's really unknown, but at least they're looking. You know, all efforts are underway to identify the cause of the illness. So, you know, that's an ongoing thing. We'll find out if it's something new or this is really just a side effect of malnourishment.
Yeah, very, very unfortunate and difficult to find clear numbers in that case, in that sense. But we will, of course, continue digging and trying to find the most recent updates that we can. Now, our other huge story over the past few months has been the H5N1 avian flu, bird flu here in the US and globally. We reported on a human case in a child in California a few weeks ago, and there's been some updates on that case as well as the situation in general. Can you bring us up to speed?
Yeah, so the child was infected with avian flu, and they sequenced that virus that the kid had, and it is very close to the strain that's affecting the dairy cows in California. And the child had no direct contact, so we don't know how the kid got it, but he had it. But the child has recovered. The other kind of interesting case is there's two other things going on there. There is the teenager from British Columbia who got very, very ill and is in the hospital, and they keep reporting on the same kid. So the Canadian, he's sick, he's very sick, he's still in the hospital. Or if it's a he, we don't even know. If the person is very sick, they're not going to report anymore unless he goes home or passes away or whatever. But he's stable but very sick, and that's all we need, you know. The other thing going on with that is that in California, they got reports of illnesses affecting 10 people who drank raw milk, even though the state has recalled of such products after the bird flu virus was detected in some of the samples there. So these 10 sick people did not have avian flu. One child did test positive for influenza A, but they don't know if it's bird flu or not. The child recovered. That investigation is still going on. So and we don't know if these cases are actually linked to raw milk or it's just going around and they identified those people because they were being looked at more closely because they had raw milk. But just remember, raw milk is a risk for many bacterial and viral diseases. So what's going on there in California, and that's under investigation.
Yes, and of course, raw milk has come up a lot more recently due to the avian flu, but avian flu is not even close to the only pathogen that could be found in raw milk. Yeah, so better to be safe than sorry, in my opinion. Though, you know, it is a free country. You can do what you want.
Especially in people at risk. So, you know, very young kids, pregnant women, older people, anybody with any kind of underlying serious health problem. You know, it's dangerous to drink raw milk.
Absolutely. And speaking on something else that has been very dangerous this year, we have had a record number of dengue cases and deaths this year in the Americas. Can you break down the numbers for us?
Yeah, last year there were 4,000 deaths due to dengue. We'll see here in the Western Hemisphere. This year it's 7,700. So it's almost double last year. And the overall number of cases are estimated at 12.6 million, with 21,000 of them being severe. So 21,000 severe cases means they're in the hospital. And 7,700 deaths. You know, it's twice as much as last year almost. So it's particularly devastating in 4 Latin American countries, which account for 90% of the cases and 88% of the deaths. And that's Brazil, Argentina, Colombia, and Mexico. So we don't really know why it's going up so much, and if this is going to be a pattern. Typically, dengue went in these like 4-year cycles, and we don't know. I think we're a little bit off cycle here, so we'll have to see what happens. You know, as these cases go down now, what happens next year? But this is a lot of dengue and a lot of deaths and morbidity. You know, people ending up in the hospital.
Mm-hmm. Our next story today is a very tragic one. It revolves around young premature children in Mexico, and there was contaminated infant IV feeding bags, resulting in some deaths. Can you tell us about it?
Yeah, there's a plant that manufactures intravenous fluid that's, I guess, specifically for kids or includes children in Toluca, Mexico. The company's been shut down, and the use of the product, of course, has been halted. But the number of children that got infected with bacterial infections, 2 multi-drug resistant organisms, Klebsiella oxytosa and Enterobacter coaki, which caused blood infections and death in 17 kids, 13 of them from the outskirts of Mexico City, and the other 4 spread in Michoacan state and the north central state of Guanajuato. So, I mean, this is really tragic. It's just so unfortunate. And this has happened, you know, this can happen anywhere where a plant, you know, gets in you know, contaminated product, delivers contaminated, whether it's, you know, breast milk substitute or, you know, IV fluids, or, you know, whatever. So it's just very tragic.
Very tragic, and something we hope we won't have to report more cases on, but it looks like the public health efforts there have really kicked into high gear, which is good news.
Mm-hmm.
Our final story today, hopefully ending on a bit of a higher note, revolves around the Global Pandemic Treaty and hopes that we all have for that to be finalized. Can you give us any updates?
Yeah. So the Director General of WHO, Dr. Tedros Ghebreyesus, publicly stated that he's confident that the 194 member states of WHO, who've been negotiating for 2 years on some kind of plan to deal with the next pandemic, if there is one. You know, things were so chaotic during the COVID pandemic, and the reporting structure, nobody knew who had what or who had what medications or vaccines, or, you know, the numbers and everything. They're just coming up with a framework that everybody can work with if this happens again. This is just like great public health. Like, be ready for the next one in a nice, smooth, organized way to deal with a worldwide pandemic. Anything that's spread, you know, by the air, you know, any respiratory thing. I mean, it's going to be worldwide very quickly. Look at how people travel, and, you know, and airplanes, you know, other, you know, it's just going to spread everywhere so quickly. So they're very close to an agreement, and he's very optimistic that they're going to have this agreement, and he believes that the United States has been a very good partner in this whole arrangement, and that I think we have to face it here, the United States. People here have to understand that we cannot be safe unless the rest of the world is also safe.
Mm-hmm. Yes, pathogens do not respect international borders. or even domestic borders here in the US or elsewhere. So we got to be prepared.
They don't need visas or passports. They just move around.
Exactly. They just hitch a ride with all of us or other things. But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise this morning, answering our viewer submitted question and breaking down all of the newest data for us.
Great. Thank you, Katie.
And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. We'll hope to see you again next week. And of course, if you have any questions or comments, please leave them down below or at any of our social media linked in the description. Have a great weekend.